This week's Ask Dr. Durie is a common but continuingly important question. This is from a lady who asks, do lytic lesions in the spine ever go away? And so this means the holes in the bone in the spine caused by the myeloma, do those ever fully heal up if the myeloma goes into remission? And so a very, very important question. And the answer is a combination of yes and no. And so when the myeloma is active, these lytic lesions or holes in the bone do occur. And in the spine, this is a problem because a vertebra, one of the areas of the spine, can certainly collapse if it's a large hole or a large lytic lesion. And this is a problem in terms of the stability of the spine and pain that can result from collapse of a vertebra. If the myeloma is treated, the myeloma goes away, but essentially you are left with a hole. Now this hole does fill in somewhat. It fills in with scar tissue and some calcium is laid down. And so the yes part of the answer is that the area does fill in a little bit, but the important no part to the answer is that the area of the lytic lesion really does not recover normal remodeled bone. And so the key thing for patients to be aware of is that this area in the bone is still weak, and when we take a picture of the bone, typically we will still see this area of lytic lesions or the hole. And this is very, very important to be aware of. Now, this hole will persist despite successful treatment. The area could be treated with radiation. You could have successful overall therapy with chemotherapy, with transplant. And so the myeloma could definitely be wiped out. And the area could be somewhat strengthened with the use of ongoing Zometa or Iridia. But this is really not enough to fully recover the strength of that vertebra in the area of the lytic lesion. And so what should a patient do? Well, if there is an area of lytic lesions in the spine, so please discuss this with your doctor if you're aware of it, and even ask the question if you're not so sure. It's important to know if there is a lesion, maybe it's enough of a concern that kyphoplasty should be performed. Maybe it's important to inject some cement into this area to stabilize the vertebra. Maybe it's something that's bad enough that even some type of repair surgery should be required. Or maybe it's something just to be aware of. And so I would say the biggest area of concern is that as you're going into remission, many times the pain is going away and you can be much, much more active. And so if you do have a lytic lesion, just be aware that you do still have a damaged spine, and just to have a degree of caution if you've not had kyphoplasty or other types of intervention to make sure that you're in good shape. And so be aware that there may continue to be an area of weakening in the spine, and discuss it with your doctor and make sure that it's dealt with in a way such that you can go forward with physical activities that are appropriate, with the idea that we do want you to return to as full and active a life as possible.